the outbreak of measles in Usar community, Gorajo, Igabi local government area of Kaduna State. The Senate notes with serious concern the outbreak of measles in Usar community, Gorajo, Igabi local government area of Kaduna State since Monday, 15 July 2019. Regrets that since the unfortunate outbreak, over 100 children in the community have lost their lives. Worried that the death toll could still rise due to the slow response of the Nigerian Center for Disease Control, NCDC, National Primary Healthcare Development Agency, NPHCDA, and other emergency medical units responding to and curbing the spread of the disease. Note that Nigeria ranks among the countries with the highest cases of measles infections in the world, according to the World Health Organization, with state in northern Nigeria recording the highest attack rates. Note also that World Health Organization statistics have further indicated that over 750 children died in 2015 alone due to the poor nature of health sector, and many of these deaths were vaccine preventable. Believes that the outbreak and consequential death of over 100 children in Usar community, Gorajo, Igabi local government, and the loss of lives of several other children all over the country will have been prevented if the children have been vaccinated. Note that the National Immunization Financing Tax Team, which was set up by the National Primary Healthcare Development Agency in 2015, estimate that 15,000 is the ideal amount needed to properly vaccinate a single Nigerian child, thereby putting the total amount needed to vaccinate children in Nigeria at approximately 120 billion, given that approximately 8 million children are born in Nigeria yearly. Note with great concern that the 21.25 billion which was allocated for vaccination in 2019 budget is almost 100 billion less than the total annual requirement. Observe that the Nigerian Center for Disease Control, which was graciously established by a bill sponsored by the 8th Assembly and signed into law by Mr. President, is not adequately funded. Aware that the Nigerian Center for Disease Control was established to, among other things, prevent, detect, monitor and control diseases of national and international public health importance, including emerging and re-emerging diseases. Develop, maintain, and coordinate surveillance systems to collect, analyze, and interpret data on diseases of public health importance in order to detect public health threats, guide health intervention, and set public health priorities. Lead the response to disease outbreaks, public health emergencies, and disasters in order to minimize the impact of health. Conduct, collect, synthesize, and disseminate public research to inform policy and guidelines on diseases of public health importance, and put in place a national public health research agenda and database. Provides guidance, technical logistic, support to the states and local governments for the planning, implementation, and management of diseases of public health importance, and on activities to reduce health risks and impacts from public health events. Provide support and coordinate the control of national and transborder responses to mass public health emergencies, such as mass casualties, floods, nuclear, biological, and chemical terrorism, disease outbreaks, and heavy metal poisoning. Aware also that the NCDC has a statutory responsibility of setting up zonal centers in all geopolitical zones of the Federation and offices in all the states of the Federation. Observe that the NCDC neither has a zonal center in the north, western geopolitical zone of the Federation, nor a state office in Kaduna State. Observe also that available indicators show that the overall performance of NCDC is being hampered by lack of financial resources, infrastructure deficit, and lack of drugs, vaccine, and equipment. Believes that increasing the budgetary allocation for the management of this agency will significantly aid them in performing their statutory functions to Nigerians. Convinced that the establishment of an Office of Nigerian Center for Disease Control in Kaduna State will drastically reduce the chances of recurrence of measles outbreak in Kaduna State and lead to the early detection of a response if there is to be another outbreak of infectious diseases in the future. Accordingly, resolved to sympathize with the people of Gusar community, Gwarajuwat Igabe local government of Kaduna State for the unfortunate measles outbreak and observe a minute silence in honor of the children who lost their lives as a result. 2. Direct the Nigerian Center for Disease Control, the National Primary Healthcare Development Agency, and National Emergency Management Agency, NEMA, to, as a matter of urgency, report to the community for on-the-spot assessment with a view to providing relief materials and all other necessary support as may be necessary to mitigate the loss suffered by the community. Urge the Federal Ministry of Health, the National Primary Health Development Agency, the Nigerian Center for Disease Control, National Orientation Agency, and other relevant federal government agencies to embark on and intensify massive sensitization and awareness campaign on the dangers associated with measles with a view to eliminating the scourge in the country. Direct its Committee on Primary Health and Communicable Disease, one constituted, to engage the Director General of the Nigerian Center for Disease Control on the status of the center's statutory requirement to have zonal centers in all the 6 geopolitical zones and offices in all the states of the Federation, as well as follow up on the activities of the center. Direct the Nigerian Center for Disease Control to set up an office in Kaduna State in earnest. And finally, increase budgetary allocation for the management of the Nigerian Center for Disease Control and the management of national primary healthcare development in order to fast-track the establishment of zonal centers in all the geopolitical zones and offices in all the states of the Federation. I so submit, Mr. President.